Hi, I'm Dr. Carol Hong from Family Vision Care and Vision Therapy. Do you suffer from burning, itching, or constant red eyes? Do you ever feel as if there are little pebbles or sand in them? Or maybe you get blurry vision and your eyes might always be tearing. These are all symptoms that you may have a condition called dry eyes. Well, it's best to make an appointment with one of our doctors so we can thoroughly examine your eyes and determine the best treatment for you. Here is Jeremy, one of our interns from SUNY College of Optometry, who will review the top 7 ways to start combating these dry eye symptoms.
Hi, I'm Jeremy. I'm a 4th-year optometry student, and I'm here to talk to you about dry eyes. So dry eye is a really complicated multifactorial disease, but in a nutshell, we can define it as a disruption in the normal makeup of our tear film. And our tears are composed of mainly 3 things. So first there's mucus, then we have water, and then we also have oils in our tears. The mucus works as a lubricant to the eyes and keeps our eyelids from sticking to our eyeballs whenever we blink. And the water, of course, hydrates our eyes, and then the oil works as a protective layer over the tears to keep them from evaporating so quickly. So when one of these 3 things isn't working properly, that's when we start to experience the complications of dry eyes. And this can come with or without symptoms, but if we leave it untreated, it can cause permanent damage. Because dry eye is such a complicated disease, there isn't one singular treatment that's going to work best for everyone. And it's often a combination of treatments that's needed to get symptoms under control. But hopefully, these quick, simple tips will get you started on your way to becoming symptom-free. So the first tip I have is to modify your environment. So what that means is if you're in a room where the air conditioning or the heater is blasting, that can really dry up the air and then in turn dry up our eyes. So what we can do about that is modify, let's say, where we're sitting. So you can try sitting somewhere that's not directly under the vent, or you can modify the thermostat to a temperature that might be a little more temperate, or just turn the thermostat off altogether and save some money on your bills. Something else you can try doing is using a humidifier to add some moisture back into the air. So another thing to try is something that we call deep blinking, which is essentially fully closing your eyes all the way, holding it for a second, and then opening them again. Normally when we blink, we're doing so without even thinking about it because it's just our brain's reflex to our eyes starting to feel dry. But when we're looking at something like the computer or a TV for a long period of time, we're so focused on whatever we're watching that we ignore those feelings of dryness and just forget to blink altogether. So really just being cognizant of that and working some deep blinks into whatever you're doing throughout the day can really help with your dry eye. And to add to that, you can try something called the 20-20-20 rule. So what that means is every 20 minutes that you're looking on your phone or the computer or reading a book, you want to look somewhere 20 feet away for 20 seconds, and while you're doing that, you can do 20 conscious blinks. So studies have shown that applying this 20-20-20 rule can help reduce eye strain and eye fatigue, and this will also help with your dry eyes. So you're kind of killing 2 birds with 20 stones. Let's talk eye drops. So there's about 1 million different types of eye drops in stores, so from a buyer's perspective, it can be really confusing knowing which type of drop to buy. Something to stay away from would be a redness relief drop, because those drops, while they do get rid of the redness, they're not treating the underlying dryness which is causing the redness, and it can actually make your dryness even worse. A better option to use would be artificial tears. So something like Refresh here or any of these options also work great. And what these drops do is they act as a supplement to our already dwindling tear source. And you can use this once in the morning when you wake up and once in the evening before you go to bed. And you can also use it once or twice throughout the day if your eyes are bothering you, but I would try not to use these more than 4 times a day. And that's because these have a chemical preservative in them that can actually be damaging to our eyes if we overuse them. So another type of drop that you can use is a preservative-free artificial tear. So that'll come in a box of little vials like these. So these are single-use vials. So you can use these as many times as you want, so more than 4 times a day. But if you're using them really frequently, then that probably indicates that you could benefit from another type of dry eye treatment as well. So just another reason to go see your doctor. Gel drops are actually better than artificial tears at keeping our eyes lubricated because they stay on our eyes longer. But they can cause our vision to get a little bit blurry after you put them in, so it's most often recommended to use a gel drop at night right before bed. But you can use it throughout the day if you find it to be more helpful. One of the many functions of our eyelids and our eyelashes is to protect our eyes from debris and harmful bacteria. But sometimes they can accumulate and contaminate our tears or block our oil glands. So what we want to do is we want to keep this area clean with a lid scrub or a lid wash. And so the first thing I want to show you is this is Avenova. So Avenova is a hypochlorous acid solution that kills bacteria in less than a minute. And this is newly available over the counter, and all you have to do is spray your eyelashes, and that's it. And it's a really quick, easy thing to do to keep that eyelash area clean. The other thing I have is OcuSoft. So OcuSoft is a lid scrub that's really highly recommended by eye doctors. It comes in this moistened pad and also this foam spray. So you can use either one. The foam spray, you spray on a paper towel and wipe your lids and lashes, and then you'll use a new towel to wipe the other eye, and then you'll rinse with water afterwards. The moistened pad works the same way. It's just that the spray is already built into the pad, so you don't need to spray anything onto it, so it makes it a little bit easier. And those things you can also buy at your local eye doctor's office. But if you don't have those at home, what you can also try is some baby shampoo mixed with warm water. And you can put that on your finger or a paper towel and clean around your lids and lashes. Cleaning the lids is recommended twice a day. So if you want to do that in the morning when you wash your face, and then at the end of the day when you shower, that's a really easy way to make sure you do it consistently. So the next thing that you can try that might help with your dry eye is something called a warm compress. And the goal of a warm compress is to add more oil to the tears to again act as that protective layer to keep them from evaporating. And inside each of our eyelids, there's about 50 to 80 oil glands. And the oil inside of these glands you can think of kind of as like butter. And so when that butter is colder, it solidifies and it's harder for it to flow out of the glands. But when you melt them with heat, it gets a lot easier for them to come out into the tears. So the easiest way to get these oil glands to melt is by using a mask, kind of like this one here. And you can see there's a lot of gel beads inside, and aside from just being really fun to squish around, they actually retain heat really well. So really simple, you just throw it in the microwave, you take it out, and you just wrap it around your head and pretend you're at the spa for about 10 to 15 minutes. You can buy these at your local eye doctor's office, or if you don't have it at home, you can use things that you do have around the house. So I like to use something like raw rice in a sock, or you can microwave a potato and make sure you wrap a clean towel around it. So you can get creative with these types of things. Just really important is one, that they retain heat well, and two, that it's clean and sanitized, because if you're putting dirty things around your eyes, you could cause some type of eye infection, which would be even worse than the dry eye. This next tip goes hand in hand with that warm compress, and it's called a lid massage. So after you've melted the oil inside of the glands, you can help push it along by massaging it out. So you can start with your finger up right below your eyebrow and close your eyes and just roll your finger down toward your eyelash, applying a good amount of pressure, but not too much to where you're causing pain. And then on the bottom lid, you can put your eye right below the eyelashes and roll them up toward the eyelash. And again, this is just going to help those melted oils come out of the glands more easily. Omega-3 fatty acids actually have an anti-inflammatory component that helps to reduce the inflammation on our ocular surface, and this can also help with our dry eyes. And you can find omega-3 fatty acids in foods like fatty fish or mackerel, and you can also find it in flaxseed, walnuts, or even just use pill supplements. Alright, so that concludes my top 7 tips for relieving your dry eyes. And even if you don't feel like your eyes are dry, applying these simple tips to your everyday life will help benefit your eyes' overall health. And super important, if you did try these things and haven't been able to find relief, go see your eye doctor so that they can do a full, thorough evaluation of your eyes and figure out the best treatment option for you. And from everyone here at Family Vision Care, we'd like to thank you for watching this video, and we can't wait to see you at your next appointment.